My name is Harper Wagner. I am the Director of Business Transformation at YRCI, also a HeartMath certified trainer. We are starting our Stress Month, Mental Health Awareness Month program with this session. We'll be running weekly sessions all of May. So Wednesdays, 12:15. Thanks for joining the initial session. As we always do, want to start off with practicing heart-focused breathing just to get ourselves centered. And we've got Andrea joining. Welcome, Andrea. Right on time to practice heart-focused breathing. So I'll walk you through this first, and then we'll practice. You can do this eyes open or closed, cameras on or off. The process that will follow is going to ask you to place your attention in the area of the heart. And you're going to imagine your breath is flowing in and out of your heart. And you're breathing 4 to 6 seconds in, 4 to 6 seconds out. And that's the practice. So let's start our heart-focused breathing practice. Focus your attention in the area of the heart. Imagine your breath is flowing in and out of your heart or chest area. Breathing a little slower and deeper than usual. Find an easy rhythm that's comfortable. Breathing in and out of your heart. Imagining your breath is flowing in and out. Mind wanders. Gently bring your attention back to your heart and your breath. And as we move through the rest of our session, the 10 minutes we have or so remaining, just try to keep this going as long as possible. And we've done this in previous sessions. If we can make this close to a 15-minute meditation, it adds a little bit more weight to the practice and also makes it a little bit more practical. As you continue throughout your day, the more we can be familiar with what it's like to come back to the practice. We engage with whatever's in front of us, and then we come back to the practice. That's really what I'm asking you and inviting you to do here. This is Mental Health Awareness Month, and in the last session mentioned the relationship that science and research is starting to make between stress and mental health, and not just the obvious of the cause and effect. If I'm in a stressful situation or I'm feeling stress repeatedly, my mental health noticeably takes decline. I'm sleeping not as well. When I'm experiencing stress, that's due to the cortisol that's being pumped into the blood. And cortisol is one of those things that helps us go. It doesn't help us rest. DHEA, another chemical that's released into the blood when we're experiencing uplifting emotions, calmness, coherence in a way. That's what helps us to rest. The cortisol is being uh, shown to actually deteriorate mental health. So there's connections that are being made now, the cortisol in the blood and the mental health of an individual. Um, that's affecting it in a negative way, deteriorating mental health and our mental faculties. And DHA is showing that it is contributing to better memory, especially in older adults. And it can actually counteract some of the cortisol's negative effects on the brain. These are things that, as more and more research are done, we'll have more answers. This is relatively new. We've only been working with heart science in this way for the last 30 years. And the relationship between stress and Alzheimer's and dementia, and more eyes are getting on that, thankfully. And we know that those illnesses are debilitating when they are severe. And my mother is affected by dementia, and yeah, it's not a serious case. She knows who I am, and but at the same time, it is something that is troubling many loved ones and folks that are in our circles. So, the more that we can learn about possible causes of mental illness, and the more that we can do something about it, we're making our change in our world and being able to share that with others. So, the HeartMath practices, you know, um, there's one that I'd like to finish with here that is going to be an extended practice. It's called Heart Lock-In. And Heart Lock-In has been one that is practicing this 5 minutes a day over the course, I think, of 6 weeks. They did a research study of, I think, up to 40,000 people in this study. And the impact that it's made of practicing just this technique for 5 minutes for 6 weeks increased the emotional um, stability of the practitioners, increased the sleep quality, decreased anger, frustration. It was marked improvement in those areas. We'll walk through this first, and then we'll just practice. As most of the HeartMath techniques we start with heart focused breathing. And then we're going to activate and sustain a regenerative feeling such as appreciation, care, or compassion. And appreciation for me is just a go-to. I can activate that pretty quickly. And I've been practicing that for years. And it is a tool in the tool belt. It's like the hammer or the screwdriver for anyone that works on as a handyman or a woman. That's being able to go to something and like, I see another nail. Appreciation. I see a lot of nails. Appreciation is one of those things that we can appreciate so much in our lives. Even just the ability to sit in this chair upright. Little things that may go unnoticed, that we take for granted, and that this can change your life. The reason why it can change your life is that we can up level our vibration or baseline essentially with appreciation. By continually practicing appreciation, we up level our vibration, or it feels different when we practice it, when we truly feel appreciation in our heart. So it's a practice worth exploring if you don't have an appreciation practice or a gratitude practice. And something that I can't say enough for. So we're going to activate that appreciation, care, or compassion, whatever you have access to. And then we're going to radiate that feeling to ourselves first and then to others. And that other can be your family, your friends, work, community, and on out. No No need to stop wherever you feel comfortable. The scaling out makes sense. So heart focused breathing, we're going to activate and sustain that feeling, such as appreciation, care, or compassion, and then we're going to radiate that out. Those are the first, or the only three steps. So let's go ahead and practice. You can do this eyes open or closed. And actually, this one is eyes closed, since we're going to be doing it for quite a while. I'm going to do it for at least 3 minutes. Let's go ahead and move into this. Focus your attention in the area of the heart. Imagine your breath is flowing in and out of your heart or chest area. Breathing a little slower and deeper than usual. Find an easy rhythm that's comfortable. Activate and sustain a regenerative feeling, such as appreciation, care, or compassion. And radiate that renewing feeling to yourself and others. Extending my appreciation to all of you. Thank you. Wishing you all a lovely afternoon.